Hi class, my name is Liz Lara and I'm going to present the heart-lung bypass machine. In an open heart surgery, the bypass machine and its development revolutionized our ability to perform delicate procedures on hearts. There will be at least one and often more of these devices in every cardiothoracic surgical program. The function of the cardiopulmonary bypass pump, often referred to as a heart-lung machine or simply as the pump. It mimics the function of the heart and lungs by temporarily taking over the heart's and lungs function during surgery so the surgeon can work in a bloodless surgical field. Used during coronary artery bypass and other cardiac surgeries, as well as heart and lung transplantation. The heart-lung machine is a fixture in any cardiac operating room. The cardiac surgery had begun slowly in the 1940s with just a handful of operations that could be done without the use of cardiopulmonary bypass. In the early 1950s, closure of atrial septal defects with the use of apothermia or the Gross well. However, by 1950, it became obvious to those interested in cardiac operations that a heart-lung machine would be required to deal with the majority of congenital cardiac malformations and valvular heart disease. Between 1950 and 1955, at the University of Toronto Medical School, William Monster developed a heart-lung machine that used insulated monkey during as the oxygenator. In Detroit, at Wayne State Medical School, Forrest Dorrell enlisted the help of engineers from General Motors to develop a heart pump, the Dorrell GMR heart machine. It was said to look very much like an old Cadillac V12 engine. John Given at Jefferson Medical College in Philadelphia had been working on this problem longer than anyone else. His machine used DeBakey roller pumps and a film oxygenator. He had received engineering and financial assistance from the IBM company, and his heart-lung machine was said to resemble a punch card business machine. On May 6, 1953, Gibbon, who devoted his life working to obtain a working heart-lung machine, performed an atrial septal defect repair that became a landmark in the development of this technology. So here is the heart-lung bypass machine of these days, and we're just gonna go through the parts so you can learn a little bit more about it, and we're gonna do just clockwise, I guess. So first in the top, that's a flexible LED lamp that only consumes 6 watts. On the right, we have a shelf, and this is a control panel for the entire machine. Right here, there is a 4 support mounting masts. Then right here, the roller pumps for moving blood impulses. Down here, we can see a transformer and electrical connections. In the bottom, it's a storage drawer. Then the chassis that holds electronic models. And then right here, the emergency battery that provides uninterruptible power supply for the entire machine. Then up here, we have a 2-in pump model that handle low flow rates. Then it's the sidecar used to move the unit. And up here we can see the water-resistant computer with battery backup as well. So how the heart-lung bypass machine works. So first, the oxygen-poor blood leaves the heart to enter the heart-lung machine, right here. The second step is the heart-lung machine pumps and removes the carbon dioxide from the blood and adds oxygen to the blood before it returns to the body. Then the oxygen-rich blood returns to the body, of course, keeping the heart and the lungs. In order to perform a cardiosurgery, doctors use anticoagulants to avoid complications. And unfractionated heparin was first used in 1953 for cardiac surgery, employing cardiopulmonary bypass, and has remained the standard anticoagulant ever since. But there is another alternative for anticoagulant for cardiopulmonary bypass during adult cardiac surgery, and it's bivalirudin, and it has half of the life of approximately 25 minutes, and is mostly cleared from the circulation by proteolytic enzymes, and approx 20% is cleared by the renal system. Another substitute is algatropan, and this anticoagulant is for patients with heparin allergies during the coronary bypass surgery. Okay, so the oxygenator. Bubble oxygenators are largely for historical interest in the era of membrane oxygenators. The membrane oxygenators consist of hollow microporous polypropylene fibers. Blood flows outside the fiber while gases pass inside the fiber, separating the blood and gas phases. They have less propensity of air embolism and give greater accuracy in blood gas control. Newer designs have an integrated filter to manage emboli, thus making additional arterial filters necessary. A heat exchange is integrated with the oxygenator and placed proximal to it to reduce the release of gaseous emboli due to alterations in the temperature of saturated blood. Perfusionist. Perfusionist is the person who runs a cardiopulmonary bypass pump during surgery. The perfusionists typically have a bachelor's degree in a health-related field, then pursue an additional 2 years of education training as a perfusionist. Some perfusionists take an exam to become a certified clinical perfusionist, which is similar to a physician being board certified in a specialty. I have 2 questions for you. And this is why is cardiopulmonary bypass used? How does a cardiopulmonary bypass work? And who runs the cardiopulmonary bypass machine? I hope you enjoy my presentations. If you have any questions, concerns, if you'd like to add comments, I will greatly appreciate it. I will answer all your questions. And last, there's my citations. Thank you.